card. My student ID is 186083218. Today I am going to perform the procedure of sterile dressing change. Firstly, reviewing the physician order for ambulation and dressing change. Now performing hand hygiene and going to the patient. Hi, good morning.
Good morning.
Can you tell me your name and date of birth?
My name is Surinder Pal. Date of birth is 6 September 1995.
Let me confirm with your wristband.
Mm-hmm.
Okay, so I am Amanjot Kaur, one of the registered nurse here. Today I am taking care of you. As physician has recommended to change your dressing, are you comfortable with it?
Yes.
Okay. Before starting the procedure, I have to ask you a few questions. Are you okay with it?
Yes.
Okay. So can you please tell me any kind of discomfort or uneasiness you are feeling today?
No.
Okay. Are you feeling any kind of pain?
Yes.
Okay, can you rate your pain on the scale of 1 to 10, like 1 is the least pain where 10 is the extreme level of pain?
It's 3.
Okay. Do you need any kind of medication before the procedure?
No.
Okay. Do you have any kind of allergies from medication, solution or latex allergies?
No.
Okay. So now I'm repositioning the bed as per according to my height and repositioning the patient. Can you please move to this side?
Yes.
Okay, are you okay with it?
Yes.
Okay. Now I am providing privacy and performing hand hygiene. Turn gloves. Now this is my workspace area, which is easy to reach and is well organized also. So now opening the dressing set with aseptic techniques. First glove away from myself. Now to the sides. Repositioning the dressing set. Manipulating the supplies. Placing the Q-tip, maintaining the 5 centimeter borders and pouring the solution from an appropriate height. Opening the sterile absorbent pad. Opening the sterile gauze. Now I have maintained the sterile triangle, patient, my dressing set and the waste receptacle. Now I am going to opening the old bandage of the wound. There is no need to change my gloves as I have just opening the wound. As you can see, this is a serous sanguineous discharge present. Firstly, the location of the wound. The wound is present on the abdomen, on the midline, and is above the umbilicus. Now measuring the location of the wound with the measuring guide. The wound is approximately 12 centimeter in length, and the approximation of the wound, the edges of the wound are well defined and attached, and there is no presence of any erythema, any discharge and any edema. That is, there is no chance of any infection, and the sutures are well intact, and thus it is secured with sutures. Now palpating the wound. Are you feeling any kind of pain while palpating? So the patient is feeling mild pain while palpating and there is no presence of any tenderness. Now changing my gloves. Hand washing. Putting on another pair of gloves. Now taking one piece of gauze. Squeezing it. One stroke of gauze for cleaning a midline, that is head to toe. Discard it. Another piece of gauze. Squeezing it. Now to the periphery, that is away from my body. One stroke. Now to the periphery, which is closest to my body, head to toe. Pat dry from head to toe, similarly from the midline. Now to the periphery farthest from my body, pat dry. Now to the periphery which is closest to my body and head to toe similarly. Placing the sterile gauze. Now placing the absorbent pad. Securing the wound with the adhesive tape. Now mentioning the date and time of the procedure performed. Now I have performed the procedure of sterile dressing to you, and do you feel any kind of pain right now or any other concerns? Okay, so now I am going to reposition the bed and reposition the patient as well, and holding the giving the call bell to the patient. If you need any kind of help or any other concern, you can call me and let me know. So I have performed the procedure of sterile dressing, and while documentation I will document all the readings in the patient chart. That is, the location of the wound is on the abdomen, on the midline above the umbilicus, and the length of the wound is 12 centimeter, and the closure is the wound is enclosed with the sutures, and for the approximation it is the edges are well defined and attached, and the discharge is serous sanguineous and serous sanguineous. There is no presence of any kind of edema. There is mild pain while palpating, no tenderness and no erythema. So this was all about my procedure. At last I will perform hand hygiene. So thank you.